So very good afternoon to one and all. Vanakkam. So let me begin by a question. How many pediatricians exist in the country in total? Any guesses? Total number of pediatricians in India. I'll give you some numbers. 20,000, 40,000, 70,000, 1 lakh and above. Excellent. This shows how poor we are in statistics. So there are about 50,000 pediatricians in total, which is 1,500 pediatricians who pass out every year, many of whom do not practice. Some of them leave the country, others go into business. Likewise, through our right to information, you have 846 community health physicians coming out of the country. Much of what they do, some of you all would be aware. And we are expected to take care of a 1.2 billion nation. Isn't the numbers frightening? 50,000 pediatricians, even far less community health physicians for a 1.2 billion nation. This is just the brief numbers which I've introduced you with. So next, moving on to another question. Who, according to you, are children? You deal with a lot of kids every day. Who do you think are children? Please speak up. In your eyes, in your opinion, in your experience, who are children? 0 to 14 years, okay. Anybody else? 12 years, adults. 0 to 12, anything else? Anybody wants to take guesses beyond these numbers? Okay. So children are the economic future, a social policy, an insurance saving, and for some parents, even lottery tickets, but for all, a convenient package. This is how I would like to see children. And then you have the family. Who eats how much? Who goes where? What's their education? Whether the boy, the girl would study up to which level is defined by the parents, sometimes by the grandparents. Sometimes you have before their first birthday, they'll say, Mera pota doctor banega, engineer banega, scientist banega. Arey yaar, at least take care of the child before their first birthday. After that, take care of the child till the child is under 5. What if the child suffers from upper respiratory tract infections like pneumonia or diarrhea? That's it. I'm reminded of one of the incidences during my external monitoring with the World Health Organization. We were surveying one rural family in India's outpost villages. So it was a family of 7 children. And the mother wasn't around, so I had to deal with the father. So I asked him, what's the birth date of child number 3 or number 4? I don't know. So forget about him knowing the age. He doesn't even know the birth date of the children. So that brought me to a very pertinent kind of thought, saying that, okay, are you very comfortable and satisfied with 7 kids? Of course. They are my financial investment. Some of them will become rich tomorrow. Some of them would get married to some rich people. If at all nothing else, some of them would take care of me. So you look at the very psychology of how kids are viewed. So it's like if you have too many number of children, at least few of them would be there for you when you're around and when you need them. Article 6 of the UN Convention on Child Rights talks about the maximum extent of possible survival for children. Article 24 of the same UN Convention for Child Rights talks about the highest attainable standard of healthcare for kids. Given this background, how many of you all say that health is a human right in our country? Please raise your hand. How many of you all feel health is not a human right in India? So all of you all are wrong. The Constitution of India has shied away from declaring health as a human right up front. Health is not a human right in India. In bits and pockets, of course, given the fact that health is listed under the state subjects as the directive of state policies, Article 47 talks about giving good nutrition to children, providing them optimum kind of education, these kind of things. But nowhere in the Indian Constitution is it mentioned upfront that health is a desired human right. That's why if you've seen the historical progress of India since 1947, no elections have ever been fought on the healthcare agenda. 2018 is declared as the thematic year for universal health coverage. But then where are we? How are we going to achieve universal health coverage? Or is this just going to remain an over-ambitious English word? You've had, when you compare India with other Western countries, including America, you've had Obamacare coming in, you've had a lot of other schemes which are implementable. But what's going wrong today with our health systems? We have good amount of schemes, even in terms of IMNCI, integrated disease surveillance programs. But then you also have several insurance schemes like the Rashtriya Swasthya Bima Yojana. But the question I'm trying to raise today is, what do these schemes really mean to the last man on the ground? What does these schemes really mean to the father and mother in those local areas? Does that mean anything to them at all? In many of those surveys which we have carried out, most families have never heard of the insurance schemes. Some of them, if they've been lucky, they have an ESI number and these kind of things. But otherwise, they have nothing at all. This brings us to another question. What is the number of, or what is the out-of-pocket expenditure in India? 3,633 rupees is spent on one child getting affected from diarrheal disease. So imagine a family with a below poverty line card requiring to spend 3,633 rupees, and like the story I told you about 7 children, if 4 to 5 get diarrhea, it's a watershed moment for that family. 6.4% of the household's income goes in spending for healthcare. So what would be the savings then? How much of free government schemes is really possible? We've reached a world today where oral rehydration solutions, oral nutrition solutions has taken a backseat for India's children. But you go to any rural area, you have Coca-Cola in there. You have all soft drinks, you have all the fast food joints reaching even the rural places. But why is it that you don't have essential, life-saving sachets and medicines not going to those areas? Somewhere down the line, I think you and I play a role in that. India as a cultural nation has evolved from an ancient civilization into an ever land today. If you look at Indian history, from those times of dowry deaths to the age of snake charmers, today we are taking people to moon. But the implementation or the way diarrheal disease is looked at also requires a systems approach. You really need to factor in what the family as a whole feels about diarrheal disease management. You just saw in the skit of how different age factors, people influence the treatment patterns and outcomes of diarrhea. Reminds me of the Johari window in management, where if we are to decode that into healthcare, what the doctor knows is one component, what the doctor doesn't know is another component. What the mother knows about her child and diarrhea is one component, what the mother doesn't know is another component. There is another fifth lateral angle to it, what the mother and the father think they know about diarrhea. That's where, as pediatricians, as community health physicians, as social physicians in the marketplace, as local healthcare providers, we need to bring in the holistic approach to this whole concept. What do we do in bringing in this holistic approach? It's not out of the world, or it's not something rocket science. It's very simple, straightforward things about how we communicate to the mother and the father during an episode of diarrhea, irrespective of whether it's going to be acute diarrhea, chronic diarrhea, or even dysentery. What are we going to tell the parents? How is it going to happen? That's what we need to arrive at. That's what we need to reach at. For a simple thing that, okay, if the child has suffered from diarrhea, say 3-4 days, it's our duty to tell the parents saying that, okay, please do provide 2 extra meals for the next 2 weeks so that you prevent undernutrition, you help the child recover with those supplementations. Things are as that, it's very simple. It's not out of the world, but that's what we need to focus on, and that's what we need to also arrive at. There were few studies and surveys done where they tried to understand the impact of antibiotics on diarrheal disease management. And 25% of tertiary care providers gave second generation, third generations cephalosporins, amoxiclav, and all kinds of things. You also had 78% of secondary care providers who did the same, let alone primary care providers, because there's data insufficiency in India, so there's not much documented. But then, is antibiotic warranted in diarrheal disease management? Not at all. You don't need that. Plan A, Plan B, Plan C is more than sufficient with adequate ORS and nutritional supplementation, and to an extent zinc. That's all. It's that simple. But then why do we lose 400 children every day because of diarrhea in India? 400 children die in India because of diarrhea. 0.9 million children lost their lives in a year. And India leads in terms of diarrheal deaths, under 5 deaths. And then second is Nigeria, and then is the Democratic Republic of Congo. So imagine, who are we comparing ourselves to? We should be worried and concerned, at least in some way or the other. I started off traveling a lot while I was a student, and then of course my commitments in community health took me places. This put 2 questions in my mind. See, how can people who I know and their children be different from the people I don't know and their children? On one hand, you have poor kids suffering from diarrhea because of limited access to clean drinking water, poor sanitation, inadequate, housing facilities, problem families, which brings into account the social determinants of health. And on the other hand, you have the child from a rich parent getting diarrhea because of food poisoning. So what kind of a world are we creating then? You would have seen children who are aged by their appearance or by their physical stature as 8 to 9 years old, but otherwise they're actually 13 to 14. These are some of the most authentic children of India. Children who should actually be bubbling with energies, playing in schools, thinking and wondering about science, are left to understand, discover disease and death in their neighborhoods. That's got a lot to do with our conversation today. The integration of community health workers and pediatricians. We've worked for too long in isolated and fragmented quarters, thinking whatever work we do is the best. That's one of the reasons that while we've achieved skyrocketing successes, we have failed abysmally in healthcare, particularly also in terms of maternal and child health. Reminds me of a story which happened on 13th of July 2016 in Saran district of Bihar. A lot of parents had gathered around wanting to get books for their children. And the school did not have a building of their own. So what happened is they borrowed a neighboring community building, and then there was a teacher appointed who had no place to store the meals, the midday meals. So she would keep it in the residence. And then what happened is while the cook was preparing the food that day, there was some foul-smelling odor coming out. So the cook intimated the teacher, saying that, okay, things don't look very normal here. There is some kind of odor coming out. Maybe we should not feed the children this food. The teacher blatantly ignored, said nothing happened, just give. That day the children consumed the food. Some of them started having nauseating feeling. After some time, diarrhea started, and some people vomited out. And by the time the first child got ill, the teacher's husband volunteered, saying that, okay, we'll pay the medical expenses of the kids who fall sick. So in some hours, because of this delay, one child died. The moment they got to know that one child is dead, the teacher and the husband and the whole family fled off from the area. By then, around 40 kids were affected. They went to the neighboring primary health center. There was only one medical officer who was scared. He said, no, I'm not going to treat these many kids. You please send them to Patna. This is not done. So in that process, 23 children died that day for no fault of theirs. Was the teacher guilty? Was the doctor responsible for these deaths? Was it the parents' fault because they could not afford something better for their children? The truth and the answers lie in these questions, buried alive. So what we can do in our own simple way as health workers in the locality, the moment you come across cases of diarrheal disease from one particular area, inform and intimate the district health officer, intimate the district RCH officer, and in your own humble capacity, what we can do is conduct an outbreak investigation. That would be the best thing to do. Verify the diagnosis, evaluate the diagnosis, prepare an action plan, a hypothesis, and then submit the report. You would save more people by just leaving it to go that way. With this limited background information, it is my humble request to also focus on the nutritional component as a health education to those parents coming to you, to tell them that every episode of diarrhea, 1 to 2% of body weight decreases. It's very important that we convey these messages to them. You would have several questions being raised, which of course can be answered. But let's begin with this. It's a simple life-saving solution, ORS addressing nutritional supplementations together. I ask of you to believe and hope not in my ability to tell you, but in your own experience and belief in life. Thank you. Thank you very much.
Thanks, Doctor. 1 minute, if you can take a couple of questions, Doctor. Any questions at all? You have slips in your kit, question answer slip. If you want to ask a question directly, my friends here will help you with the mic. You can ask a question directly, or if you want to write it and give it, you can write it and give it. Doctor will address it. Couple of questions, Doctor? Yeah? Anyone? Any questions at all? Some startling facts there for me as a layman and not a doctor. Health is not a human right in India. My eyes just opened now.
Aman, there's a question here.
There's a question.
Soon after diarrhea, what type of nutrition you advise?
So ma'am, you can give simple nutritional supplements that are available within the home, like bananas, oranges, which is more a soluble fiber diet. Oatmeals can be considered, ragi. These are simple things. Even if the child refuses, try to initiate frequent feedings. Like at least in the whole day, 4 to 5 times the mother should be able to try to feed the child. So these simple available items is what the mother should give. There's no point prescribing something out of the world where one option is they can't afford it and the second option is they would not go to buy it. So these simple available food items is the best solution, some soft food.
Excuse me. Can we give cow's milk during diarrhea?
You can give if the child is not reacting, and if the child has always been taking cow's milk, I think there's no need to stop it. If the child has been breastfeeding, please continue breastfeeding. If the child has been on formula feeds, please continue that. The frequency can be tapered depending on whether the child is throwing up or no, but it has to be kept on.
Is there any specific indication for mother who is breastfeeding? Is there any specific diet indications for the mother?
He can continue the same diet which he is taking and continue to breastfeed as normal itself. There's nothing else that needs to be done.